Welcome to the Farming Your Career podcast with host Dr. Aaron L. Albert, where we explore a variety of healthcare and pharmacy-related topics, including career development, healthcare IT, informatics, innovation, entrepreneurship, STEM, women's issues, and more. Farming Your Career podcast is part of the Pharmacy Podcast Network, and Aaron has had the #1 most downloaded episodes of 2016 and 2017 of the entire Pharmacy Podcast Network. Now, here's your host, Dr. Aaron L. Albert.
Welcome back to Farming Your Career. I'm Aaron Albert. Today, we pick up with part 2 of our 2-part mini-series in conversation with DeAnn Mullins, a former NCPA president in 2017, and in addition to being a mom, a pharmacist, and an entrepreneur, we focus in this part of the conversation on her presidential year and what her podium and platform stood for. We also focus on Healthcare 3.0 and Z Dogg MD. And last but not least, why advocacy is absolutely critical for all pharmacists to get involved in nonprofit associations. So give a listen, and if you haven't listened to part 1 of our series, we'd encourage you to go back and give a listen to that as well. So here we are, part 2 with DeAnn Mullins. So let's shift gears a little bit. During your NCPA presidency, your platform was kind of focused on the concept of pharmacy unity. So can you tell us a little bit more about that and how you went about it?
Yes, absolutely. So, as president of NCPA, you have a big microphone, and I have a big passion for pharmacy unity and for fixing our broken healthcare system. But how do you take on that big idea with only 12 or so months? And really, once you get elected and you get your feet on the ground and you get going, it's really more like 10 months or so that you have in terms of productivity. And we joked a lot during the year. My hashtag was, I only have a year to save pharmacy.
That's a long one to type out on Twitter.
Yeah. So I also wanted to plant seeds that would continue my vision to strengthen our profession and to fix healthcare through unity long after my year was up. So that was kind of, my thoughts going in. And my first challenge was figuring out a unity strategy. So how do you get people to unite? History teaches us that people unite when they share a belief. So I boiled everything down to answer this question. What are our shared beliefs with each other, with physicians, with nurses, with plan sponsors? And so in answering that question, I decided to work on unity on 3 fronts. So first, pharmacist unity, and that's pharmacist to pharmacist, through NCPA's commitment to establishing and growing the CPESN network. CPESN, another acronym for us to learn. It's an important one, though. It's the Community Pharmacy Enhanced Services Network. And at NCPA, we like saying that we are taking back pharmacy one enhanced service network at a time. And taking back our profession is a cause that has created a lot of excitement in the community pharmacy space. And thanks to a CMMI grant, we have and that's so another acronym, right? Centers for Medicare and Medicaid Innovation, CMMI grant. We have a successful value-focused pharmacy model that we can now scale. And the Community Care of North Carolina model is one example of the ways community pharmacies are showing their value and being compensated for that value. So CCNC was part and received a CMMI grant and really showed a lot of value.
Okay, so we got a lot of acronyms flying around here. Community Care of North Carolina and NCPA were working together. So can you talk a little bit more about that partnership?
Yes. So CCNC and NCPA have partnered to establish and grow a network of those, as I mentioned, enhanced services pharmacy through the network. So it's CCNC plus NCPA equals CPESN. KISSING.
Wow. Acronym soup here tonight. Yeah.
Yes.
Okay.
But all of our listeners, all you guys and gals can learn more about CPESN online at cpesn.com. And we're really looking to identify and engage pharmacists that want to build a new payment model in order to get paid differently. So that's Pharmacist Unity. Second, unity with the larger healthcare ecosystem of clinicians like physicians and nurses. So in order to move collaborative practice and gain a seat at the table, pharmacists need to be top of mind with healthcare decision makers, and that includes our clinician colleagues like physicians and nurses. So pharmacists, we all know our value, but our colleagues, not so much, right? While I was researching revolutions, I found a grassroots movement called Health 3.0. And the voice of that movement is a physician, and his name is Dr. Zubin Damania. You with me so far?
Yeah, so tell us more.
So Health 3.0 is made up of frontline healthcare professionals, mainly physicians and nurses, and now pharmacists, who are committed to changing our dysfunctional healthcare system. And people who support Health 3.0 believe in a healthcare delivery system where human relationships are put back at the center of care, where care is team-based and collaborative, where everyone practices at the top of their license and clinicians support each other, no more hierarchies or turf wars. Everyone is held accountable for outcomes, including patients. Technology helps, not hinders patient care. And providers are paid based on outcomes, and they're paid to keep people healthy, not just to click boxes. So, in other words, having metrics that make sense. Can I hear an amen?
Amen. Yes. Preach to the choir.
Dude, when I read Health 3.0, I was blown away. Yeah. I was like, Houston, we have a shared belief. Instead of starting a revolution, I thought it would be so much easier and more impactful to just join one that's already close to 1 million people strong, and that's mainly physicians and nurses.
All right. So before we recorded tonight, I was watching your video with Z Dogg. So let's break it down. Who is this physician, and tell us about his presence, particularly on social media?
Yeah. So the voice of Health 3.0 is Dr. Zubin Damania, and he is a Stanford-trained physician. He's a thought leader, an influencer, and he uses storytelling, humor, and music to shine a light on the dysfunction of medicine. And probably even more importantly, he is having meaningful conversations about solutions to the dysfunction. Conversations that I believed pharmacists should be joining. And one other little thing you should know about Dr. Damania, his brilliance shines through his alter egos, Z Dogg MD and Doc Vader. And Z Dogg is basically the Weird Al Yankovic of medical parody videos, and Doc Vader is Z Dogg's alter ego that often goes dark side on everything and everybody's super mean. And Z Dogg's tribe is called the Z Pack, of course, yes. And they are over 1 million strong. His parody videos, his daily and weekly Facebook Live shows have over 250 million views. His shows get, about 40,000 views per episode and about 1 million post engagements. His podcast is rated in the top 10 medical, on iTunes, and he gives tons of keynotes which reach a diverse group of physicians and nurses and health plan sponsors, technology vendors, and lots of others in our space. So my thought was that Zubin Damania, Z Dogg MD, had the potential to insert pharmacists into the hearts and minds of a vast array of healthcare providers and decision makers in a way that we as pharmacists really could never do ourselves.
So let's kind of glue it back all together. So how do we do that?
Yeah. So all these kind of puzzle pieces were coming together. So here's what we did. We contracted Z Dogg as our keynote speaker for our annual meeting. It was this past October, and he was amazing. Best I've ever heard. And we have had as our keynotes presidents and generals and best-selling authors. And Aaron, I'm not kidding you, by 1,000,000%, he was my favorite.
Yeah.
And I've heard it time and time. I've heard it from old, I was really worried about, our older pharmacists. And I had one of our 80-year-old past presidents tell me it was the best keynote he had ever heard. So I knew we had hit the mark.
Yeah.
The other thing we did, my friend Jeff Key at Pioneer RX, being the visionary that he is, agreed to fund a pharmacy tribute video for us called Just a Pharmacist. And so we shot it in Vegas where Z Dogg headquarters are, and it currently has over 2 million views. And a huge part of that 2 million are healthcare professionals, doctors, nurses, plan decision makers. So I hope everyone will go. If you haven't seen it, go check it out. It's Just a Pharmacist. It's a parody to Biz Marquis's Just a Friend. And it can be found at Z Dogg, and that's dog with 2 G's, ZDOGGMD.com. In fact, Todd Urey actually interviewed Zubin in a podcast, so I hope listeners will check that one out too. I was a guest on Z Dogg's Facebook Live show talking about pharmacy, and that's called, we named that Interview with a Drug Dealer, and you can find that. You can search that on his website, Interview with a Drug Dealer, or you can go on Facebook. You probably Google it. And we had close to 40,000 viewers, and the comments were overwhelmingly positive for pharmacists, Aaron. I'm telling you, I was so blown away at how awesome nurses, nurse practitioners, physicians, technicians, dietitians, I mean, all of his tribe really, really had great things to say about pharmacists, and in the comment section, hundreds and hundreds of comments. And Zubin has this to say on his website. He said, a pharmacist practicing at the top of their license as part of a collaborative team with the patient at the center, that's the secret weapon that will help us build Health 3.0. So I hope your listeners will learn about and support Health 3.0 and help make sure that Z Dogg's conversations always include the value that pharmacy brings to the new healthcare ecosystem.
That's incredible. That's really awesome. And yes, we will be sure to get the Z Dogg interview in the show notes for this show as well, for the podcast. Right. So you said you had 3 areas of unity that you were working on. So did we touch the third yet?
Well, so the third was, it really didn't, there's only so many hours in a year, and I got to work on this one, but not as much as I would have liked to have. So this will be an ongoing project for sure, as will Health 3.0 and Z Dogg and the CPESN network. But my third area was expanding the untapped potential of female pharmacy ownership. So some of the things that I was involved in, I held the first ever Pharmacy think tank meeting, and we did that at the NCPA annual steering committee meeting last, I think it was May or so, in DC. Then I was invited to speak with a panel of amazing women in Australia at the Australian Guild's Pharmacy Connect event that they had this past summer. And that was an incredible experience. And of course, our ongoing work as board members, you and I both, with our good friend Eden Sulzer through Cardinal Health's Women in Pharmacy Initiative, which, as you said earlier, is where we first met.
Yeah.
So yes, unity. My primary goal was to work on connections and relationships with everyone who shared similar values and beliefs and who believed in fixing our broken healthcare system. I said this a million times during my presidential year, but people unite when they share a belief, and a shared belief, well, I think it can change the world.
Well, with that, DeAnn Mullins, how can people find you and learn more about you and your pharmacy?
They can learn more about NCPA. How about that?
Sure.
They can learn more, and mullinspharmacy.com, and I'm on Twitter, but really ncpanet.org. You can visit facebook.com/community farm. Well, it's Pharmacy, so COMMPHARMACY, and also on Twitter at COMM Pharmacy for Community Pharmacy, and then CPESN.com. And I hope that our listeners will learn about and support Health 3.0 and help me make sure that Z Dogg's conversations always include the value that pharmacy brings. And an easy way to take action is to definitely experience him, like, share, comment, and really, join the Z-Pack, join the conversation. And he's got a TED Talk that you can watch online as well. But really, we need that interaction. And he's not for the faint of heart. He is a potty mouth, but he's authentic, he's hilarious, and he's committed to bringing frontline practitioners together. And I just adore him. Lord knows that we all love to complain. Here's our chance to be a part of the solution.
Okay, I totally missed part of your, I scrolled down and I thought we were done. I'm sorry.
Okay, that's yeah. Are we editing now?
Oh yeah, we're totally editing. Okay. I can have Todd edit this part out. So do you want to pick up on page 22, and then we can do the last question? I'll have him cut that to the end. Are you okay with that?
Absolutely. I thought maybe you were cutting for time, so that was my big pause. I was like, oh crap.
Yeah, no, we're at an hour, so what I might do is have him break it up into two parts, and then I can just do intros and outros that explain part 1, part 2, if that works for you.
Oh, wow. Yeah,
we can do
that's
that.
okay. If
yeah,
you think
absolutely.
the content's good enough.
Yeah, sure.
Okay. So we did CCNC. I'm sorry, I don't have pages numbered like
Question 6, how in your view will independent practice change during the future is the next question. So
okay, I'm ready.
Are you good? Okay. So, DeAnn, how, in your view, will independent practice change in the future?
Well, Katharine Graham says, to love what you do and feel that it matters, how could anything be more fun? And I say to love what you do and feel that it matters and get paid for it could actually be the most fun. And I believe we're going to see a bifurcation of pharmacies in the future. It's unlikely that PBMs will start paying more. We're going to continue that fight. But instead of being paid more for dispensing a product, think about being paid differently. Of the $3.2 trillion that we spend annually on healthcare, pharmacy is basically viewed as a cost center to that overall healthcare spend. We have an opportunity to impact the cost of care on the medical spend side, but we need innovative payment models in order to do that.
Okay, so let's talk about, give me some concrete examples of getting paid differently.
So any combination of MTM, medication therapy management, or comprehensive MTM now that's really starting to get acknowledged, wellness programs, chronic disease management, ACO relationships, collaborative practice, pay for performance, transitions of care, things like that. Okay.
So what would an innovative model look like, in your opinion?
Yeah, so there is a convenience care marketplace right now, and those would be people with lower risk and lower cost, right? Those patients, lower risk, lower cost. That would be a mom on birth control pills that needs to drive through at 8 p.m. at night, okay? There's a need for that. Then you have that's convenience. And then you have complex care, and that marketplace has higher risk and higher cost patients, and I would say higher modifiable risk patients. So think senior, multiple disease states, multiple medications, but still fairly active and seeking a high quality of life. And in the middle of that, you have the conventional care marketplace, and those patients are just in between those two kind of extremes. So that complex care marketplace makes sense for pharmacies driven to provide better patient care and who want to get paid differently. A volume-focused pharmacy is where the patient needs a prescription, and a value-focused pharmacy is where the patient needs a pharmacist. So fast, accurate, and cheap, that's volume, versus revenue beyond the fill for outcomes or value. These pharmacies will continue to dispense too. That's important because the product drives the relationship. So I'm not saying that these complex care pharmacies won't dispense. They will. But in the new healthcare environment, for those patients who need a pharmacist, there will be a place for value-focused pharmacies. And I think CPESN is really all about that. So you can compete on price or you can compete on differentiation. Differentiation on the services offered and the value provided matches our current healthcare trends, right?
Yeah. So can you expand on differentiation then?
Yeah, so just what can you do differently that helps the provider improve outcomes? Or what can you do differently that improves patient outcomes or quality of life or satisfaction? And what can you do differently that saves the healthcare system money? Whoever can answer these questions, differentiate, should do well in the future healthcare market. And I do want to be clear, Erin, the convenience care marketplace, that volume dispensing, it's not going away, but competition and price pressures don't make it a very attractive arena for all community pharmacies.
It almost sounds like fast food versus five-star dining. I always like to get analogies, but yeah, like you could go to Taco Bell or you can go to Lebec Finn or whatever nice restaurant is out there. So
love it. Yes.
Yeah. Okay.
Yep.
So let's shift gears a little bit. I always love to get a shout out to the pharmacy students, the future practitioners.
Yes.
Yeah. So if a pharmacy student was thinking about independent pharmacy practice today and owning her own store, and yes, I said her, what advice do you have for her based upon all these trends and future practice models that you've seen and that you'd like to see come to fruition, and as former president of NCPA?
Yeah, so one of the first things I would say is if you expect to get paid for every single hour that you work, independent practice may not be for you. But if anything that I've said so far about family and about flexibility and following your curiosities and, having a life well lived in those areas, if that's resonated with you or been a good fit, then I would say find an independent to partner with. When we retire, we want to sell to another independent, not a chain. And be innovative. Position yourself as a potential business partner to an independent that you're interested in maybe partnering with or one day buying. Maybe you offer to revenue split in helping that independent establish a needed service like immunizations or pharmacogenomics or comprehensive MTM, or maybe in physician office staffing of a pharmacist. I mean, be innovative and approach that as a responsible business person, an entrepreneur. And I think you'd be amazed at how many doors will open with current independent pharmacies and practices. Some no-brainers: don't graduate and get into a ton of debt, and don't lock yourself into a job and bills that give you little to no flexibility. Some other good pointers: join NCPA. We have super affordable annual rates for staff pharmacists, for students, for recent grads, for technicians. The categories run anywhere from $50 to $235 a year, so it's not a lot of money. There are a ton of resources online, and many of those are free. You can attend one of our owner shop workshops, which are geared toward prospective pharmacy owners. You can attend our annual convention. It's held every October. Subscribe to our QAM newsletter. It's awesome. Comes in every morning. It's quick. It's free. It's easy. So there's a few tidbits.
Yeah. Okay. So if a pharmacist was thinking about getting involved in serving in an association as you did in 2017 as president, and now as immediate past president of NCPA, what advice do you have for him or her?
Great question. And gosh, let me give you a visual. Here I am getting up on my soapbox now.
Here, I'll just hand it over.
Thank you. Yeah, let me borrow that. All right. Being a pharmacist is about taking care of people, and it's about relationships. It is a core desire to help people be well. And we do that day in and day out. And I always say it's our superpower in a value-based system of care. But you can't stop there. I challenge every pharmacist to get involved and embrace that change is our new normal. And in a changing world, our best strategy to survive and to thrive is to come together. Hospital, chain, independent, academia, we're all pharmacists, and we should all care about the things that threaten to devalue or harm our profession. So I care about the challenges that the hospital and chain pharmacists face, and those pharmacists should care about PBMs. And academia, you educated us to practice at the top of our license, so you should be very protective against anything that stands in the way of that. Our healthcare system is broken, and together we can fix it because it's the right thing to do for our country, for our communities, for our friends, and for our families. So we should all be involved. At a minimum, you can write a check and become a member of NCPA or APHA or ASHP or your state association, whatever makes sense for your primary practice. But goodness, be a member and then show up and do some work. Always being mindful to protect and grow our entire profession, not just your little corner. Be involved, do good work, and the opportunities will follow. And please, as my mentor, Dr. Lucinda Main, once said to me in a pharmacy school lecture, don't be a freeloader.
Amen. I'll get on my soapbox again, too.
Okay.
With my pom-poms. I totally agree with you on that. Yeah.
Okay.
You can't, you're a professional. You've signed up for a profession. That means you have to advocate for that profession. That means you have to check in. You can't just go to work and go home and collect your paycheck. You've got to be more involved than that. So, amen. I'm with you. How can people reach you and you learn about your pharmacy and learn more about NCPA, DeAnn? So, to learn more about NCPA, you can go to ncpanet.org. You can visit facebook.com/community pharmacy, and it's COMM pharmacy, so it's shortened. Same thing on Twitter at COMM pharmacy. Mullinspharmacy.com for me, and CPESN.com for our enhanced services guys and gals. And I hope, Erin, that your listeners will learn about and support the Health 3.0 movement and help me make sure that Z Dogg's conversations always include the value that pharmacy brings. An easy way to take action on that right now is to experience Zubin Damania at zdoggmd.com. And you can watch all of his parody videos. They are ridiculously fun. EHR State of Mind and Blank Script are awesome. You can watch and share and like our Just a Pharmacist tribute video that he's made for us. In fact, that's my pharmacy in several of the shots. I didn't know that.
Featured Mullins Pharmacy. Yep. And I have a little cameo in there. I'm hard to find, but I am in there. You can watch and like my interview with a drug dealer. It's the one-on-one with Zubin, and we do talk a lot about pharmacy and that relationship. Join the Z-Pack on Facebook, join the conversation, and make sure it includes pharmacy. When you comment as a pharmacist, he sees that and he gets that, and his other Z-Pack members do. And it's just a great way to show and be involved in the solutions that are in those conversations for the solutions that are going on out there. So whatever you can do to retweet, like, share, get the message out there for Health 3.0 would be super, super helpful. There is a warning. He is not for the faint of heart. I love him, but he is a potty mouth. He's authentic, though. He's hilarious, and he's committed to bringing frontline practitioners like pharmacists together with physicians, nurses, the whole care team. I adore him, and Lord knows we all love to complain. Here's our chance to be a part of the solution.
Awesome. Well, DeAnn Mullins, thank you so much for being part of the Pharmacy Podcast. Are you ready for our speed round?
Okay, let's go.
Okay. What books are you reading right now?
Tools of Titans by Tim Ferriss, The Four Tendencies by Gretchen Rubin, Tim Urban's blog, Wait But Why. It's mind-blowing. I love it. I'm obsessed. And two books on deck for me, Single Women Entrepreneurs, 5 years later by my friend, Erin Albert.
I did not pay you to say that, by the way.
You did not. Don't edit this out. Don't you dare. And Entrepreneurs in Pharmacy and Other Leaders by George Zurich. I think those are two awesome books by two awesome folks. And so I'm checking those out next on deck as soon as I get through with these.
Well, thank you. So what podcast are you listening to right now?
Z Dogg MD, of course, Tim Ferriss, and then TED Talks. I listen to a TED Talk almost every day. Get the app, and Pharmacy podcast, of course.
Of course. What's your one word to describe the U.S. healthcare system right now?
Okay, so you've interviewed me. One word, really. Okay, here's my one word. It's crazy pants.
I think that's two.
No, it's one. Crazy pants separately means something else.
Okay.
Urban Dictionary. Look it up, crazy pants. But please let me tell you why really fast.
Okay.
It's a combination, our healthcare system, of miraculous, dysfunctional, broken, mediocre, expensive, and ripe for disruption. Our system produces exactly what it's designed to produce: high cost, low quality, low patient, and low clinician satisfaction. So if we change the design of the system, then we change the outcomes. And until then, it's crazy pants.
Okay. And last, but certainly not least, what is the best career advice you ever received?
Yeah, so life balance is a myth. You will never perfectly balance everything all at the same time. My Christmas tree stayed up my entire NCPA presidential year. And a close second for people like me is that perfection is the enemy of good.
Well, with that, again, DeAnn Mullins, thank you so much for being part of the Pharmacy Podcast. We really appreciated your insights all around, not only associations, being an independent pharmacy, community member and owner, as well as your leadership in women in pharmacy practice. We so appreciate your leadership, and thank you again for being part of the podcast.
Thank you so much for having me, Erin. It was a lot of fun, and right back at you for all that you do for the pharmacy profession as well. Thank you.
Thanks for listening to another episode of Farming Your Career. I'm Erin Albert. This podcast mini-series is brought to you by my new online course, 57 Cool Jobs for Pharmacists. You can find it over at farmllc.teachable.com. Maybe you're at a career crossroads and you need to dissect and figure out where you want to go next in terms of your career development. And I would love to help you with that. Again, go to farmllc.teachable.com.
Thank you for listening to another episode of the Farming Your Career podcast, part of the Pharmacy Podcast Network. If you have ideas or comments for Erin, be sure to contact her through Twitter. Follow her at Erin L. Albert. And remember to keep your career growing.